My perspective is from orthopedic surgery, and being a surgeon, there's pain, right? I mean, if you're having surgery to fix a meniscus or have a knee replacement or hip replacement, there's going to be pain associated with that. So in our business, I mean, pain is part of what we do, and so are narcotics. And I think narcotics are perfectly fine. I mean, right? They're designed for a reason, and if used for the right reasons, they're okay. But the problem is patients who come in with a dependence, right, or an issue before surgery, or patients who come into the clinic and don't need surgery, but they've got a problem, right? And so they've got a simple injury that for you and me, you'd take Tylenol. You know what I mean? But they're requesting narcotics. And then you have patients that develop a dependence after surgery. I think that alternative treatments would be something like, for example, acupuncture or chiropractic or massage therapy, physical therapy. I mean, all of those things are really important in what we do. There may not be a lot of great data on them, you know what I'm saying? But they don't hurt people, and oftentimes they provide more benefit than harm. So those things are all really important. What we try to do is set the expectation straight from the beginning in terms of how much should this injury hurt you, how much should this surgery hurt you, because I think a lot of it is expectations, right? If you're having a surgery and you don't know what to expect, you don't know if it's normal to have that much pain or not. So, I mean, I think at Summit we really try to tell them ahead of time what to expect. And then I think the other thing that we use a lot to minimize narcotic use is good anesthesiologists. So we use a lot of what we call nerve blocks of the leg or the arm before surgery, so that the patient needs less anesthesia because that extremity is numb for surgery. But we also put in long-acting numbing medicine in the knee or the shoulder or the hip, for example, to get them through those first couple hours or days that are the worst. Say that hopefully now with more awareness, that as providers, we would recognize those signs and symptoms or those problems sooner than later, whereas maybe before they just weren't addressed, and it became a problem. And now I would hope that we would identify that person and maybe get them to the pain clinic sooner than later before it gets to that point.